most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
Well, in our opinion, of course, Bob.
Brad, today we want to talk about hip flexor strain or tendonitis.
Sure.
And how do you treat it? How do you stretch it? How do you strengthen it? The big three.
Yes. It's
So-
kind of interesting, Bob, because just last night, I got my hair cut. Did you notice?
Yeah.
Anyways, her daughter, the woman who cut my hair, her daughter has a hip flexor strain playing basketball, and she was asking me advice on this last night. I told her, go to our channel, we have some good information.
Wow, and I must have telepathically knew that because I started putting together this topic.
It
on
is amazing how things work out in life, isn't it?
By the way, if you are new to our channel, you've never seen us before, I hope we didn't scare you off already, but make sure you take a minute to subscribe to us. It's over here on the screen somewhere.
Somewhere up there.
Yeah, we provide lots of videos. We upload every day on how to stay healthy, fit, and pain-free.
Even for hip flexor problems.
Yeah, and this is a fairly common problem,
Sure.
Brad, and that's why I think you're going to run into it in your lifetime, whether it be you or a family friend or something like that.
Right, a lot of times it's people that are active, you know, running kind of events.
Yeah, quite often athletics.
Yep.
So, all right, the pain is up here, Brad, generally.
So
Yeah. and
just below the belt line usually, right?
Right. And it's quite often the rectus femoris muscle, which is part of the quads.
Right.
But the thing that makes it different than the other quads, Brad, is that it also crosses the hip. So,
Let me get my therapy stool out, Bob.
all right. So there's this blue piece of tape represents the muscle.
Right, and this is Leopold.
Napoleon bone apart.
We haven't had him with a video for a long time. I kind of forgot
Yeah.
about him. Anyway, so the muscle we're talking about is, look how long this muscle is. It goes from below the knee all the way up, and it's deep inside the pelvis, it looks like. It's not too
Right.
close to your skin.
Now, if you feel a bump on your pelvis, that's probably this big bump here, and that's the anterior superior iliac spine. I'm going to impress him, Brad. But it actually doesn't attach to that one. It attaches to the bump below, which is the anterior inferior iliac spine. I got it.
ASIS, So it's down in here, and it's not superficial. You have to get in past the muscle to get to it.
There's a reason we're taking all this time to show you this, Brad, because we want to make sure they know where to start doing the rubbing when we're going to show them how to do the massage.
If it makes sense, you'll have a better treatment, better success.
Yeah. It actually has a little piece that comes off from right over the acetabulum here too, Brad.
Right, so it's a broad attachment to the bone, unlike other muscles.
Comes down, then it comes together with all the other muscles, and then it goes into the kneecap. So it actually bends the hip this way, and it also straightens the knee.
So
it does both.
Biarticulate muscle that we call that. Not that you need to know it.
And this way. It
right,
does both of those
two
things.
different things. And that may be one of the reasons why it gets strained often. Kind of like hamstrings.
Sure. So when you're going to, the first thing we're going to recommend, and this is the gold standard, this is the one that's going to help you the most of everything we're going to recommend today.
Yep. That's why we're showing it first.
Yep.
In case you're getting bored.
What you're going to do is find on your pelvis, you're going to find that bump. I'm going to come a little bit closer to you, Lonnie. So this is the anterior superior iliac spine.
Right there. I can
The muscle
feel
doesn't
mine.
attach to that. It attaches to this bump right below. But as a landmark, because most people can find this one, that bigger bump, you go 8 centimeters below that, which is, what, about 2.5 inches, maybe?
Right, yep.
About 2.5 inches.
Yep.
They always say centimeters. This was an English book. So
sure.
You can measure about 8 centimeters, and that's where you're going to put you're going to rub. And that's where quite often you should find the tenderness.
You know, it's not going to be exactly 8 centimeters because everyone's body's a little different, but that's pretty close.
Right.
You'll find it when you hit the spot.
So if I'm going to get myself in this position, Brad, you're going to you can be kind of relaxed. You can even, put a couple pillows into a chair here.
On a couch might be a good place to do it.
So I'm kind of in a 90-degree angle here.
So the hips flex, the little bend in the knee, you could put a pillow under here to get more relaxed if you like to.
Why don't we do that, Brad?
Sure, Bob.
So now we're in a good position here, and things are relaxed. And now I'm going to go 8 centimeters below that bump right here, which I can feel.
Get those trousers out of the way so they can see what's going on there.
And now I'm gonna be rubbing right in this area here. I'm putting one finger on top of the other, or 2 fingers side by side, and there we can apply the pressure.
And he's getting deep because we said it's a deep muscle.
You got to go very deep, Brad, on this one.
Right.
And you should be able to find it probably is going to be tender.
Right.
And you're going to go ahead and start, and if after of doing this for, let's say, 30 seconds to a minute, it gets worse, then you're going to probably back off and ice it right now.
Right. It's not ready for it. Get Get your cold pack out and lay down and put a cold pack on there, 20 minutes. But after 30 seconds to a minute, if it starts feeling better and it feels like, oh, the pain is going away,
then that's a really good sign.
How long are you going to go then, Bob?
Well, that's the thing about this, Brad. Celiacs used to recommend you can do this for 20 minutes. Nobody can do this for 20 minutes.
You're going to get such sore fingers that it's not going to work.
So what we recommend quite often is maybe just do it 5 minutes here, 5 minutes there,
right.
and you could even do it every day if you want, if you can tolerate it.
Sure.
He recommended just 3 or 4 treatments a week. And a lot of times that often would do it. It didn't take very long.
Usually, if you get this at the right time and you get it deep, usually, we have people say, boy, they notice a big difference over the first couple, 3 days.
Yeah, it responds well to this if it is the right thing to do.
Right.
It's possible that it could be down further in the muscle too, and that might be a different problem. You maybe are into the general quad, but generally the hip flexors are more up closer to the groin.
Right, and that's where the injury oftentimes occurs.
Again, I can't emphasize more, that you really have to rub this hard because you're breaking up scar tissue quite often.
Sure,
and you're getting more blood flow to the area. Again, we're getting aggressive when we do this.
So again, you're probably not going to do it twice a day because that's going to be too much for it.
Some people might be able to tolerate, if you're only doing 5 minutes, Brad, you might be able to tolerate 5 minutes.
But if you do, every time it should feel better by the time you're done.
Right, we're looking for the same symptoms every time.
Yep, symptom relief.
All right, let's say you're doing this, it actually now feels better, you're doing much better. Let's go ahead and now you're going to start doing some gentle stretching on it because that'll help realign those fibers too.
Right.
Throw me a pillow, Brad?
Sure, Bob.
This is probably the most, holy moly, Batman.
Sometimes I'm a kid.
Okay, so I'm going to stretch this one. You're going to put a pillow down. And as you can see, I'm leaning forward here and I'm putting a good stretch on that muscle.
Right.
Now, if you
notice Bob's good posture.
Yep.
He's up tall.
I'm not like this. That's
Right.
not stretching it. If I'm doing that, you're actually taking stress off the muscle.
Right.
Now I'm really leaning forward and putting the stretch on there. Good prolonged stretch. You can even make it worse, Brad.
Better, Bob.
Yeah,
Better stretch.
by pulling up like this.
Right.
Now you're really getting a good
Right.
stretch on it.
Now, keep in mind you have an injured muscle. The goal, don't go use a philosophy, no pain, no gain, because if you stretch it too hard, you're going to re-injure it.
Yeah, just give it a gentle stretch. Sometimes people later on are able to get to this point where they grab their ankle and they're bending like this and stretching
Right.
it.
And even at that, you're going to be as tall as you can.
Yeah, trying to keep in good position here. Brad, do you want to show a dynamic stretch?
Sure.
This is a good one to do before a sporting event. A lot of times they recommend, especially if you're in more of a power event, where you need
Sprinting.
Yeah, sprinting. You want to do a dynamic stretch as opposed to a static stretch. Which the static stretch, the one I just showed you, you can do after the event.
Sure.
But this one is a good one to do prior.
So keep in mind, the injury is healed up. You're done with your cross friction. The icing's all done. You're back to running, but you're not know if you can do the full event yet. So you're at the end stage of the rehab. So I like to have something to hold on to for balance. And I'm going to bring the leg back and just swing it back like this. And I feel a stretch here. And if I want to make it more aggressive, watch what I do with my knee at the end. I bend it up. Now I'm not going to hold it like that. I'm just going to leave it swing relaxed. But when I bend my knee, I can definitely feel the extra stretch, the whole length of that muscle. Again, that muscle crosses a joint here and here. So that means when I bring that up, it puts a little extra stress on it. And it's a dynamic, kind of like when you're running, everything is moving and happening quickly. So you're just preparing for that dynamic event.
All right, Brad, then we're going to show some eccentric strengthening here.
Oh, yes.
That's really the key phrase. A lot of times people are now with tendons when they're trying to help them, get the injury to heal.
Right.
The eccentric strengthening seems to help that.
Right. And they've done studies on this where eccentric strengthening is faster. It can develop the muscle faster. Weightlifters do it all the time. They call it negatives sometimes. Right.
And then, so basically you're strengthening the muscle while it's lengthening. So the one that I came up with, Brad, here is, so this is the one that's involved. Mm-hmm. So I'm going up this way, so I'm really not, it's not really working that hard. Right. But now I put it this way, and now it's working on the way down.
It's limiting that movement of the leg.
So I come up this way, and I go work it on the way down. Again, not very difficult for the first few, Brad, but when you start getting to maybe 11, 12, it's going to start working a little more.
Yeah. And
then eventually you can do some weights.
If you say, geez, Bob, I did it 15 and it feels like it can be. Or if you're just one of those guys that think that you may have to make it hurt more, but you really shouldn't, you can put a couple pound weight out on the ankle. It can make a big difference.
So again, the first one not that difficult.
Sure.
But now with this one, I'm already feeling it on the second one here. So.
And even if you're really a high level and you really want to push it, we can start the dynamic oscillation.
Right. We can start going like these.
Yeah.
And now that's a little bit concentric too, but
right. That's mixing it up a little bit.
And we'll go into those, Brad. Let's say, okay, now everything's kind of healed, everything's good. Yep. Now we can go just into regular strengthening, Brad.
Sure. Yep.
And one of them is just straight leg raises like this.
Yep.
You know, you're coming up like this. You're going to do, and I got a weight on already, so that's making it more difficult. And then you do with the power, kind of the power move at the end here.
Power oscillations. You know, another nice thing about this is when you're doing the straight leg one, Bob, you might as well go up high and get a little hamstring stretch with it and get two birds with one stone. Get
the double benefit. This one will work you. I'll tell you that one. I definitely
feel. Like much, but you'll get a workout.
All right. The next progression then, Brad, would be to standing.
And simple.
Yep. And you can do both.
Yep.
And then, of course, the more dynamic one where you kind of get into a lunge position here and you're going like this.
Sure. Yeah. I mean, you can see that's geared for that athlete where they're trying to get out of the hole, you know.
So.
Wow, that was a good job, Bob.
All right. Thanks for watching, folks.
Hip Flexorama.